Then you're gonna rinse it, and you're gonna separate the labia. You're gonna stroke down in one direction from top to bottom. You're gonna go down the center and then down each side. You're gonna repeat if it is necessary with the clean part of a washcloth for each stroke, from the cleanest area to the dirtiest. Then you're gonna pat the area dry with a towel. You want to make sure it's dry so it doesn't cause infection or anything. You don't want it to be moist still, because it will cause infection. It's possible. Then you're gonna fold the blanket back down between the client's legs, because you always want to make sure you're providing privacy and you want your client to just feel as comfortable as they can, I guess. You're gonna help the client lower their legs. You're gonna turn her on the side away from you when you're about to perform like the anal cleaning part for the rectal area. So then you're gonna apply soap to your washcloth. You're gonna clean the rectal area. You're gonna basically separate the buttocks and clean from the vagina to the anus with one stroke. That helps prevent the transfer of pathogens from the anus to the vagina. So you don't want that to happen. And then you're gonna repeat that basically until the area is clean. You're gonna rinse the rectal area with a washcloth. Pat the area dry with a towel. When you're done, you're gonna remove the waterproof pad, and then you're gonna remove your gloves and then wash your hands when you're done providing that care. So with peri-care with a male, you're gonna basically start off the same as you would with a woman client. Same first couple steps. You're gonna go in the room. You're gonna identify the client. You're gonna explain the procedure. You're gonna perform your hand hygiene. You're gonna get all your supplies that you need. Yeah, pretty much the same thing you would do, what I explained in the other video with a male. Provide privacy, all that stuff. And then once you do that, you're gonna retract the foreskin on the penis, especially if it's uncircumcised. Some people would say kind of pull it back, I guess you can say. You're gonna grasp it. And you're gonna want to clean at the urethral area. Sorry, I keep probably saying that wrong. But yeah, that's probably the cleanest part, and you always want to clean from the cleanest part to the dirtiest. So you're gonna keep doing that in a circular motion. And every time you do that, you're gonna use a clean part of the washcloth every time. You're gonna rinse that area with a washcloth. No, thank you. And then you're gonna return the foreskin, basically. Okay, sorry about that. So yeah, you wanna make sure that you rinse it properly because you do not want it to cause irritation. Then you return the foreskin back to its natural position. You wanna clean the shaft of the penis. Yeah, firm. Downward strokes, and then you're going to rinse that area. Help the client flex his knees and legs if he's unable to, or spread his legs if he's unable to. You're going to clean the scrotum and rinse well. Observe for redness or anything, discharges, anything like that you would normally be still observing for. Anything that's pretty much unusual, as we would be observing anyways, pretty much. Then you're gonna pat dry and the scrotum. Fold the bath blanket back down between his legs to provide privacy as well. Once again, help him lower his legs and turn onto his side back away from you before you are gonna provide the rectal care, basically. Then you're gonna clean the rectal area just like you would from pretty much almost the same as the female, basically. You're gonna rinse it and dry as well. Remove the pad once again, And then you're going to discard your gloves and you're going to perform your hand hygiene once the procedure is all done. So that pretty much sums up the PeriCare for male and female.